And welcome to a special edition of World Bank Live, responding to the coronavirus, strengthening global healthcare to handle the pandemic. I'm Paul Blake, and over the next half hour or so, we will hear from a panel of experts as we assess how the ongoing coronavirus pandemic is impacting the developing world. So to start things off, let's go live to my colleague Mohamed Pateh, the Global Director for Health, Nutrition, and Population at the World Bank. Dr. Pateh, thank you so much for being here. I know things must be incredibly busy right now, so I'm really grateful for your time. We spoke back in early March, and so much has changed since then. It really feels like it was much longer ago. But when we last spoke, the virus was just starting to go truly global. You said you were concerned about what would happen when it started to spread in countries that had weak and vulnerable health systems. Have your kind of worst fears been realized since then? And can you give me an overview of how the pandemic is affecting the developing world at this time?
Thank you, Paul. I think you're right. When we spoke last, the pandemic was unfolding. Now it's affected more than 1.5 million people. And we know that almost 90-something thousand people have died from it. Most of these deaths have been in the advanced high-income countries, but we're beginning to see a pickup in the lower income countries as well. For the bank, for instance, IBRD and IDA countries are about 20% of the total cases that have occurred so far. But the rate of increase is gradually picking up, and we're concerned that they may not have the health system capacity to deal with the onslaught, as we have seen unfold even in the higher income countries. If you see countries in Europe or the United States and the toll that this pandemic has had on their health systems, you have to be worried when you look at countries where health workers may not be sufficient and the facilities may not be there. And importantly, we're seeing health workers who are at the front lines be really affected in ways that can further undermine their ability to provide health services for those who are affected by COVID, but also for other infectious diseases, because there are still diseases like measles, malaria, other causes of pneumonia, childbirth, and cause of maternal mortality that are still significant in those countries with weak health systems, that COVID is also inadvertently undermining their ability to deal with it. So I think as this unfolds, I think we have to be continued to be concerned about its potential impact on the countries with the weakest health systems.
So can you tell me a little bit more about that? What's your concern both now and coming over the next few weeks and months? What regions or issues should attention really be focused as you guys continue to monitor this situation?
So first, countries have to be able to have access to good quality testing to know who is infected and to be able to isolate them and to be able to trace their contacts or limit the spread of the virus using non-pharmaceutical intervention, because there is no cure at the moment and no vaccine. So we have to rely on social distancing or physical distancing to ensure that the virus doesn't spread. We've seen how that has made important impact in more advanced economies. But the context of the developing countries, we have to find ways to adapt those measures so that they work to limit the spread, so that the health systems will not be overwhelmed. And then to prepare the health workers there, to protect them with personal protective equipment and have the requisite medical supplies for clinical cases, which can become very severe, for instance, ICU and other things. And to also engage the communities, because as this unfolds, different measures will affect how people live their lives, how they go after the incomes that they will need to feed their families. And so we have to engage them in a meaningful way with through national systems that communicate the information to them so they understand it and also respect what the public health officials are saying to them as well.
Dr. Pateh, stay with me. Let's bring in some more perspectives from around the World Bank. Joining us live now are Ernest Messiah. He's a health practice manager for Africa. Maria Angelica Sotomayor, she's a water and sanitation practice manager. And Michele Granulati, similarly a health practice manager for Latin America. Welcome to you all. Michele, I want to start with you. South America was the last continent, other than Antarctica, of course, to have a detected case of COVID-19. When the virus arrived in Brazil on or around the 25th of February, that's when COVID-19 had kind of truly reached global status, I think. Was the continent able to use that extra time to prepare a response and prepare for the virus? And how is it coping now?
Yeah, thank you, Paul, and good morning. Indeed, now Latin America has been hit by COVID-19 later than the rest of the world. And in general terms, governments in Latin America have acted quickly. They declare state of emergency and have enacted very strict measures to contain contagion. So indeed, they have taken advantage of the little time they have had compared to other countries, to other regions. At the same time, they have started taking some of these measures that Mohammed talked about to strengthen the capacity of their public health systems, to provide intensive care, which we know now is a critical dimension of a sustainable response plan. Part of the effort has included working with private hospitals to ensure that overall hospital capacity, which is very limited in many places, if not all, can be made available to all the population.
And Maria Angelica.
Just to say that this is not an easy thing to do. And in a short time, and we have seen how difficult it has been in parts of Europe and right now in the United States, so very important gaps still remain.
And we'll talk more about those gaps here in the next few minutes. Maria Angelica, I just want to turn to you. You're the practice manager for water. Can you talk to me a little bit about how water supply and sanitation factor into where the virus is being detected, where it's being adequately responded to, and just how central is water, sanitation, and hygiene globally to this pandemic and fighting this pandemic?
Okay, thank you so much for inviting me. As you know, we hear in the news every day that social distancing and hand washing with soap are two of the most effective and important actions we should take to prevent ourselves from getting the coronavirus, but also to prevent others and to prevent the spread of this pandemic. Unfortunately, 3 billion people around the world don't have access to a proper hand washing facility. That is partly due because around 785 million people around the world don't have access to safe water. And so you would imagine that it's quite difficult for population living in overcrowded slums to have access to take these measures that are life-saving measures. So we believe water is key to this puzzle, particularly in countries in the developing world, because so far most of the countries that are dealing with this pandemic don't have to deal with the underlying conditions of lack of access to water and sanitation, and their built environment is quite different from the type of environments that we're having to deal with, for example, in sub-Saharan Africa. To make matters a bit worse, countries, for example, in the Sahel are already water-scared countries. So that will just add to the needs. And then my colleagues were talking about the importance of the health system. And one of the areas that is also of concern is that we know globally 1 in 4 healthcare facilities worldwide lacks access to water, and 1 in 5 lacks access to a sanitation, proper sanitation facility. So we believe that yes, water would be key preventing the collapse of the health systems so that they can properly deal with this pandemic.
So just to put a point on it briefly to make sure I'm understanding people around the world, I think what you're sort of saying is there's tons of attention being put on hand washing right now, and that's all well and good in high income countries, but the access to clean water and sanitation and hygiene can't really be taken for granted in low and middle income countries sometimes. Is that am I understanding correctly here?
That's perfectly correct. Yeah, that's the point I've been trying to make. Yeah.
And Ernest, earlier this week, I was looking at a map of sort of known COVID cases throughout the world. you're the health practice manager for Africa. One of the things, at first glance, to me, I have an untrained eye on these things, but it appears to me that the African continent is showing relatively few cases. What's driving that trend? And do you and your team fear the worst could be yet to come for that continent?
Well, Paul, let's put this into context. Compared to, say, cases in Europe, compared to cases in the US, we see less in Africa. But in context, in the middle of February, the Africa CDC reported that there was one confirmed case in Africa. A month later, they were able to report that there had been 443 cases. And this is the middle of March. What's interesting is between the 17th of March to the end of March, that figure jumped from 443 to over 5,000. And from the end of March to earlier this week, that number doubled from 5,000 to 10,000. So what we are seeing in Africa is an exponential increase in the number of cases, which means that what you're seeing is while the numbers may be lower, the growth in the number of cases is what is worrisome. Now, what's actually governing that trend? And I think the trend in terms of numbers is the increase the testing. We're seeing more testing taking place in Africa. But what's governing the trend also, too, comes back to the comments my colleague. Number one, I think, is the difficulty of doing social distancing. And the difficulty of doing social distancing in crowded urban environments, as well as the difficulty of access to basic preventative measures, the hand washing. I mean, for most of us, it seems a simple thing. Let's just wash your hands and wash your hands with soap. But if you don't have access to clean water, and if you don't have access to soap, those two preventative measures become rather difficult in the context. So that's what's governing the trend that we see in Africa. And we're seeing an increase in the number of cases. My suspicion is that when the Africa CDC next reports on the number of cases in Africa, the 10,000 cases that we see now could in fact have doubled to 20,000.
And what are some of the challenges that health systems on the African continent will face as they try to prevent becoming the next big epicenter of the outbreak?
I think a couple. Number one, I think, is in terms of protecting health workers. Personal protective equipment, the gloves, the masks, the gowns. We need those for our frontline health workers. We also need to have the equipment that is required. And we've heard a lot of discussion about the ventilators. We need those, but we need to ensure that we protect our health workers. We need also to, as Mohammed mentioned earlier on, we need to understand that with COVID comes on top of pre-existing health challenges within the continent. So we also need to make sure that the maternal and child health agenda, the reproductive health agenda, that those agendas are also attended to. You've got a health system that is dealing with pre-existing crises, but also to this new crisis. But also to having to think within the health system of how does this affect communities and how does one do that outreach to communities? How does one do the contact tracing, which at this point in time seems feasible as the numbers look relatively low. But we need the workers, we need the funding for them, and we need the funding in beleaguered health systems that have had a lack of funding. So in a sense, this is the perfect storm that is occurring with COVID on top of pre-existing health challenges.
And Dr. Pate, I just want to zoom out for a second and sort of take stock of the global picture again. To the layman like myself, it seems like, there are a lot of cases in the northern hemisphere, relatively few in the southern hemisphere. Again, untrained eye here. But if that difference does exist, why is there a difference there? And could that dynamic change as the seasons change and the weather changes in the coming weeks and months?
This virus is teaching us quite a bit in the last 3 months since we've known its existence. So it is likely that some of the issues behind the less number of cases in some parts of the world is access to testing, as we've seen in Africa. But it may also be with the way the virus is transmitted in different contexts. Now, it's too early to make a definitive statement as to whether, in fact, the weather will play a major role, but there are suggestions that that is possible. I think we're seeing this unfold right in front of our eyes. And it's important to use the time that countries have instead of being complacent, but to prepare, to ramp up testing, isolation, hand washing, as was mentioned, but also prepare their health systems and their health workers to be able to protect themselves rather than hope that the weather would actually make it not arrive. So this is a new virus, and I think the ultimate direction, we are learning every day new ways that it is being transmitted, basically, in terms of the biology of the human body and the virus itself. So the weather is one, but also the lack of testing is also a possibility that, in fact, explaining the less number of cases in certain areas. So we don't know for sure at the moment, and I think we have to be humble enough to know that it's there are things that we know for a fact, and there are things that we're still learning as we go. But to use the time to prepare health systems and populations to anticipate if it becomes the reality, and like Enes mentioned, I think we're seeing exponential rise in certain countries in Africa overall, and that might actually become very severe on top of the other existing health challenges that they have.
All right, well, it sounds like a lot of the research is still coming in on this, trying to understand this virus that we've only really heard about here in the past few months. We've been talking for a few minutes now, and we've gotten a sense of the global situation, as well as the situations in Latin America and Africa, as well as how hygiene factors into all of this. But since the beginning of the crisis, the World Bank and its global staff have been at the forefront of the response. And the World Bank has announced that it is committing up to $160 billion over the next 15 months to combat this epidemic. Let's take a quick look. We've got a video for you. Let's take a quick look at how that money is being used. Well, we received a question from @Yigitulubel on Twitter asking how the $160 billion will be used. We saw a little bit of that video there, but let's bring back our panel and break this down a bit more. Let's go first back to Dr. Mohamed Pathé. Dr. Pathé, what are the main goals behind these emergency packages, this emergency package and the other response that the World Bank is doing over the next few months?
So the first part of the bank's response, which was announced and ultimately approved by the bank's board a week ago, was comprised of $14 billion initially. That's focused on the health response, but also the private sector response through IFC. The $6 billion for the country response in the health sector is really to deal with the emergency preparedness and begin to mitigate the impact on health systems, build national systems for preparedness over the medium and longer term. Most of it is on the emergency side. Now, beyond that, the second phase of the response is the other multi-sectoral aspects of this pandemic, social safety nets that will be required, water, food systems, and also the economic impact. The biggest impact of this pandemic is going to be beyond health. The health bit is important, and the earlier countries are able to stop the spread, perhaps the easier it might be to reopen economies. But we know that the macroeconomic impact will be severe. So most of the second phase and most of the resources will go towards those bigger economic impacts that countries are likely to face, particularly the weakest countries.
And I imagine in the short term too, improving access and the quality of healthcare that's going to be needed to combat this is going to involve working very closely with various partners and establishing partnerships around the world. Can you talk a little bit about that partner dynamic and how that's playing out?
Yes, I think on the global landscape, you've got several UN agencies. WHO is the leader in terms of the global public health response. And there is a strategic response plan which enables coordination of how countries are supported to deal with this, of course, led by the national governments as well. And I think the multilateral development banks are also playing an important role, and other global financing institutions for health, for instance, the Global Fund and Global Alliance for Vaccines, as well as Global Financing Facility, are trying to come together in supporting countries around their own resources to really respond to the urgent needs of today and build their systems for preparedness in the long run. Now, the wider economic impact goes beyond just the World Bank's own contribution. So IMF and others and other multilateral development banks are also considering that, as we have seen in the last few weeks as well.
And Maria and Angelica, we received a question on Instagram from @David Kahale asking if the 160 billion would be only available to the health sector or the various other sectors with solutions. Now, Dr. Pate talked a little bit about how over the long term, a lot of it's going to be economic impacts, but you mentioned sanitation and water issues earlier in the program. Can you talk a little bit about, as these projects are rolling out in response to the pandemic, how is water and access to safe and
we have identified 3 priority areas in which we think is critical for us to be engaged to help respond to this pandemic. The first one is to ensure there's safe water in healthcare facilities. The second one is to help improving the behaviors for hand washing, for food security, food hygiene, and ensuring safe water, soap, and hand washing facilities in key places like refugee camps, isolation centers, but also markets and other places where there's large crowds of people. And the third one is to secure access to basic water and sanitation services. And that is ensuring that during this time of crisis, water utilities have the means to respond so that those who have access really can rely on having secure water in their homes, in their working places, so that we can help contain the spread of this pandemic. We are working together with our health colleagues in many of the countries to ensure that at least some minimum supplies that are also critical, for example, chlorine, which is becoming scarce in parts of sub-Saharan Africa, is available, so that people can continue to rely on safe water for their hygiene and to ensure that the COVID spread can be contained. So those are some of the areas where we are working now, but we plan that in the second phase, there would be much higher and much more importance given to water supply and sanitation for many reasons, but also because it's a job-intensive sector. So we can also do good and create the jobs so that this probably we're better prepared in the case of other pandemics, but also we are dealing with under 5 child mortality, which is very much associated to diarrhea and a lot of waterborne diseases. So we think this is like a not regret investment that is urgently needed, and the water sector and the World Bank is being leading a lot of this around the world, and we work with UNICEF and with other partners so that this is not forgotten in the midst of improving health facilities.
And Ernest Messiah, I just want to jump back to you now. The projects that are being approved in across the African continent, is there a sort of unifying focus to them? You talked a bit about the Africa CDC doing a lot of the sort of number counting and that sort of thing, but among the projects that the World Bank is rolling out, is there a unifying focus on them that tells us something about the needs of the region? And what are the concerns for the African continent that are being addressed in these projects as this pandemic kind of rolls on? Might have a microphone issue. Can you just double check your muting for me?
Yeah, sorry.
It's all good.
One of the challenges that we're going to be facing in Africa is really how do we improve the quality of our laboratory systems? And the investments that we're making under the COVID operations actually build on pre-existing investments that we have in the health sector. I think that's an important point. It's not that these COVID investments are isolated. They build on previous investments, particularly for laboratory support and surveillance systems and strengthening surveillance systems, we have the REDISE operation, which is a regional disease surveillance and enhancement operation across the continent. We have an East Africa laboratory system, and that's building on that. We have a TB control surveillance project for Southern Africa, and we do have an operation that supports the Africa CDC. So one of the key areas for our new operations is in terms of strengthening surveillance systems. The others have to do with basic medical supplies and provisions, and in that I include the PPP.
Meaning the personal protective equipment for healthcare workers.
Personal protective, the masks for health workers, and then improving the capacity and training of our health staff. You look at it, we are actually going to be increasing the availability of supplies and equipment, but we've also got to ensure that at the same time, our human resources for health are able to cope with this increase in supplies that are coming into country. So they have the requisite training and they're deployed in the right areas. In most of the projects too, you're going to see a strong focus on behavior change communication and risk communication, and ensuring that the messages get out to communities so that they understand how their behavior, their individual and community behaviors affect the national situation. And I think
Can you explain that a little bit further? I was able to review a couple of the projects, the documentation around them, and it seems that like communications and public information is a strong component of these. Can you explain that a little bit more, especially for laymen like myself? What exactly does that mean and why is it so important?
We need to be able to explain to people what exactly is COVID, how is it transmitted. We need to be able to explain to people very clearly what are the preventative measures that they need to take. We need to be able to explain to them, should there be someone with suspected symptoms in their household, where will they find services? We need to be able to explain to them what would be expected when they are going to facilities. So we need to ensure that communities understand exactly what is happening. Why is the country taking certain decisions? What are the possible impacts and how you can mitigate those impacts? So that's the type of information we need to be able to provide to address the rumors and also to address the fears that many people may have about something that is new without fully understanding how it is transmitted and how it will affect their families. That's key in this context.
It seems getting that public understanding is very important. Michele, just want to shift over to the Latin American and Caribbean region now. I've been reading a lot about a pretty dire situation in Ecuador. Can you briefly tell us about what you're hearing there and how the bank is responding in that country? May have a muted microphone there as well, if you don't mind. We'll just give Michele 1 second to unmute. And if not, we can jump back to another guest here in a second. We'll just wait about 10 more seconds to see if it's possible. But let's just jump back to Dr. Pate real quick. Dr. Pate, one of the things I've heard, around the bank and from colleagues is just how quick this World Bank response has been to this pandemic. Can you talk a little bit about that? About just, you've been around the block here. Can you characterize a little bit of just how quick this response has been?
Yes, I think it's an unprecedented response where I think it's the bank at its best. All sectors, all units, all hands on deck, and within just a few weeks from policy paper and with the support of the senior management of the bank and the board of the bank, got it through approval, but also to get the resources to the countries immediately. And I think this is a very good example of how to respond in an emergency that the bank has demonstrated, working with the countries and putting the resources to use so that they can be able to deal with the urgent issues and the crisis that they are facing. And I think we'll see that also in the second phase on the macroeconomic impact of this pandemic. And I think that's a good example of not only within the bank, but also how it's worked with other entities in the wider global ecosystem to support countries in dealing with this crisis. So it's a very good thing to watch, actually.
And Ernest Messiah, just jumping back to the Africa region, we're still trying to get Michele Granulati reconnected here, but jumping back to the Africa region, as this sort of response evolves over the coming months, how do you see things changing, over the next 6, 12, 18 months as the bank continues to respond to the pandemic?
Well, I think, one, we will see an increase in testing. We will see an expansion of capacity in the ICU units. We will see countries perhaps also to revising their plans for the medium and long term, not just in terms of what is happening with COVID, but also to being able to assess what are the additional costs to maintain existing services under COVID context. So how does one keep the maternal and child health agenda moving forward, the reproductive health agenda moving forward? What are some of the issues that are coming outside of the health sector that affect women, that affect households? So the expansion of that agenda is going to be something that we will be able to support over time, because let's be very clear, COVID, when we look at it, it seems as if this is a health issue. It's not a health issue. This is a much broader societal issue, and therefore countries are going to be looking to see what is the nexus between what can we do in the health sector and what do we do in other sectors to be able to see what is the most cost-efficient way of approaching this. So our colleagues in WASH are working closely with us in health. Our colleagues in gender are working closely with us so that the response that we have to clients is a much more integrated approach that brings in the sectors that are going to be affected. And also, too, let's be very clear, one of the things that's affecting us in COVID is as schools become closed, you're now dealing with much more domestic issues of domestic violence. You're dealing with much more household issues that are bringing all sectors. That's where countries are going to be evolving over the next couple of months.
And if anyone's interested in learning more about that education component, we spoke earlier this week to Jaime Saavedra. That video's up on the World Bank Facebook and Twitter and LinkedIn channels. Anyone who wants to go see it can see it there. I just want to jump back. I think we've been able to reconnect with Michele Gragnolati. Michele, welcome back. Yeah. Sorry about that.
Can you hear me?
I'm able to hear you now. We spoke. I was asking you earlier about the situation in Ecuador. I've heard that it's pretty dire. Can you talk to me a little bit about what you know about the situation there, and also what the bank is doing to respond to that situation?
Sure. Indeed. And I was saying that mostly because of its close ties with Europe and Spain and Italy, especially COVID-19 has been very fast to spread in Ecuador. And the epicenter of the epidemic has been Guayaquil, the
city of Guayaquil.
The financial and industrial hub of the country. By the way, Guayaquil is a very important city because it's where in 1822, the two generals that led the independence effort of most of South America, San Martin and Bolivar, met. And, nearly 70% of the confirmed cases in Ecuador are in the Guayas province. And the images that many of you have seen of the desolation created by the surge in deaths in Guayaquil, I believe they provide the most vivid description of the risks that Latin America is facing. Then to go back to your second question about what the bank has been doing in Ecuador to respond to the COVID crisis, the World Bank, together with the Inter-American Development Bank, the Andean Development Bank, and very importantly, under technical leadership of the American Health Organization, are financing a national response plan in a coordinated and under the leadership of the Ministry of Health and the Ministry of Finance. In Ecuador, the World Bank has already approved an emergency COVID-19 fast-track facility loan for $20 million that is focusing on the rehabilitation and formation of hundreds of old and new ICU beds, and a national communication strategy targeted to targeted health workers. And then maybe let me add that overall in Latin America, we are preparing 16 of such fast-track emergency operations, and also reprogramming and restructuring 10 of the operations in the ongoing portfolio.
And what I'm hearing there too is communications also playing a big role in Ecuador as well. Another question for you. We received a question on Twitter asking about shortages of medical supplies. We've heard about these difficulties with procurement. Can you talk a little bit more about your concerns there? And is that something that the bank can help with?
Totally. Medical equipment, we have heard, is a core ingredient of the COVID-19 response everywhere. And now, all of a sudden, all countries are looking for the same medical items at the same time. And, think of the personal protective equipment that we have been talking about. It's impossible to find them in Washington, D.C. And the same is true in many places. Or think of the ventilators for hospitals in New York City. It's a big crisis, and the global market for these items is very tight. So it's a problem everywhere. So what can the bank do? What we have been doing has been, on the one side, we have been working on fast track mode. So like that, financing is made available quickly. We know acting quickly is critical. We allow for retroactive financing so that indeed these deals can be starting being negotiated before the funds are actually available. And on the other side, we have been working to collect information and share information with the government implementing agencies about suppliers in the Latin American region, but globally. And finally, when governments request, we collect demands and facilitate matching of that demand with offers for the same products. And our recommendation is to be very practical and explore all options in parallel.
Michele Grignolati, thank you so much. Just as we wrap up here, I want to go back to Dr. Mohamed Pate, the Global Director for Health, Nutrition, and Population. Dr. Pate, just as we wrap up, I think the question that's on a lot of people's minds is when is this going to be over? Is it even possible to say? And do you think we'll ever return to a sort of the normal that we previously considered normal? And finally, what's giving you hope? Like what is giving you hope as you see all this information and research and data coming through?
Thank you. I think it will be difficult to go back to pre-COVID-19 pandemic. We'll emerge into a new world, and I think the virus is already here. It will stay. It may flow and ebb over time, but I think it's already here. The optimistic news I think that I have and I see from all the conversations going on in the globe is the vaccine development possibility. In the long term, 12 to 18 months, it is likely that an efficacious vaccine might be found. And when that is found and made globally available, including to the poorest countries, not only the wealthiest countries, a globally fair allocation system for that vaccine, I think we'll see the impact of this in the long run reduced. The second optimism, I think, is the realization that investing in health systems is not only about health. It's much wider. It's about saving lives, but it's also about the wider economies and also social and political systems for countries. And the imperative for political leaders to double up and really invest in the health infrastructure, because as we are seeing now, the lack of that infrastructure, even in the advanced economies, is causing a lot of economic impact. And for the weaker or lower income countries, I think it could be even more severe. So emerging from this, perhaps we will learn a lesson that we should prepare and we should invest in health systems, not as a matter of delivering health services alone, but also as a matter of economic security and national security.
Well, Dr. Pate, thank you so much. That's all the time we have for this special edition of World Bank Live. Our guests today were Maria Angelica Sotomayor from the Water Team at the World Bank, Ernest Messiah for the Health Program Manager for Africa, and Michele Grignolati, the Health Program Manager for Latin America, alongside Dr. Mohamed Pate, the Global Director for Health, Nutrition, and Population. If you'd like to learn more, head on over to worldbank.org/coronavirus. In the meantime, please continue to follow the advice of your country's health authorities. Stay safe, stay socially distanced, and until next time, goodbye.